Now we're going to look at the section in the Healthcare Providers Toolkit for in-office use. This section includes the ACE, the Acute Concussion Evaluation, and while it looks like it might be a lot to read and a lot to complete here, it's really super quick. You can do this in 3 minutes. Everything that you need is on here to diagnose concussion. So once you get started filling this out, you'll begin to see that many of the things on here won't apply to every patient, but it gives you a place to list everything that might apply when you're looking for concussion symptoms. Please take note on here the section for red flags, and those would be symptoms that would indicate a need to get emergency services immediately. So that is the ACE. And one more thing I wanted to point out about this. On the back of the ACE, I like this because even though you're not completing more, everything you need to complete is on the front, there's a nice set of references on the back to help further explain the information and some of the wording on the front. So the next thing that we're going to have a look at is the post-concussion symptom inventory. And there's several of these in your toolkit. We're looking here at the one for ages 5 to 12, but there's also one for ages 13 to 18, and there's also an adult version. So the post-concussion symptom inventory is clearly very simple. Ask a simple question. You choose 1 through 3. You're talking about before or pre-injury versus now after the injury when you're seeing the patient for concussion. This really is nice because it's designed to be age appropriate for the patient, and the way that we ask for you to use these is to have one that the patient completes, even the young child. With every child's version, you're going to also give the adult inventory, and they're going to go through and answer the questions about that child. Those are both to be used at that initial visit in the office and returned to you. Now, the next step is that for all patients, you're going to send one home. If you remember our concussion protocol at the beginning of the items in the toolkit, we ask that all physicians have a 2-visit minimum when treating a patient for concussion. So the inventory that goes home with the person, the adult, is going to be completed over the next few weeks. They're going to be watching for any lasting symptoms, anything that's changing downstream. And if that child is still exhibiting symptoms, they're going to return to the office for that 4 weeks checkup. And at that point, it's going to be really important that parent can bring in that adult inventory to share with you. So that is the information in the in-office use section. And next, if you'll join us, we'll look a little bit more closely at the things that you can send home.